Ladies, this is the ultimate, if you wanted to, he would. I think we all know what PPE is now because of COVID, personal protective equipment. And if you're in healthcare, then you've known about this forever because it's basically synonymous with proper hygiene. But it wasn't always this way. The invention of PPE blossomed from a love story from one doctor for his nurse who had sensitive skin, and is now the reason why we wear gloves for every medical procedure. But before this, surgeons literally wore street clothes into operating rooms. They carried instruments in their pockets and reused bloody dressings to save money. Eventually, they started wearing overcoats, but they rarely washed them. I would skip this next part if you're squeamish. Some became so stiff with dry blood and other bodily fluids that you could stand them up on their own. Absolutely disgusting. Then came Caroline Hampton, who was supposed to be a proper Southern belle, but had other plans. She enrolled in nursing school in 1885 and eventually came to work under Dr. William Halsted, often referred to as the father of modern surgery. Halsted was brilliant but complicated. He accidentally got hooked onto cocaine while testing it as an anesthetic, went to rehab, and then replaced that addiction with morphine. Despite his personal issues, Halsted was pretty revolutionary, especially in teaching the fundamentals of medicine to nurses like Caroline. Now here's where it gets interesting. One winter, Caroline tells Halsted that she's quitting. Her reason, her hands couldn't take it anymore. Halsted was obsessed with germ theory and so made everyone scrub in using this intense chemical routine. Listen to this ingredient list: soap, caustic potassium permanganate solution, hot oxalic acid, and mercury bichloride. Great for killing germs, terrible for skin. And for Caroline, who already had sensitive skin, this was an absolute nightmare. Her hands developed rashes and eczema until her skin was literally sloughing off. What Caroline did not know was that Halsted was in love with her. Listen to this. He immediately contacts Goodyear Rubber Company and commissions a custom-made rubber glove specifically molded to Caroline's hands, just thin enough to perform delicate surgery work. And it worked. Caroline's hands healed, and soon other medical staff started wearing similar gloves, not just for skin protection, but because they discovered that rubber gloves actually provide better grip for medical instruments. The real breakthrough came when surgeon Joseph Bloodgood tracked infection rates. In operations without gloves, over 17% of patients developed infections. With gloves, less than 2%. And this was in an era before antibiotics. Caroline's skin problem led to one of the most significant innovations in medicine. So yeah, if he wanted to, he would. For Women's Health Month in May, we'll be sharing stories like this all month. So make sure you're following Today I Learned Science at TIL Science everywhere.